Director of the Program on Crisis Leadership here at the Kennedy School of Government. On behalf of the Ash Center for Democratic Governance and Innovation and its Program on Crisis Leadership, thank you for joining this discussion of South Korea's response to COVID-19. Before we begin, the Ash Center would like to acknowledge that the land on which Harvard University sits is the historic territory of the Massachusetts people, after whom our state is named. This place has long served as a site of meeting and exchange among nations, a tradition that Harvard now continues. Today's seminar is the first in an Ash Center Program on Crisis Leadership series entitled Leadership Lessons from the Response to COVID-19. We'll be featuring senior government officials from a number of countries, exploring how they have responded to the COVID-19 pandemic. We hope that these seminars will not only highlight a range of experiences and effective strategies employed against COVID, but also lead us toward lessons for the future. COVID, as we all know, has caused immense human loss and suffering, as well as attendant economic hardships, interrupted educations, and political tensions. This experience ought to underscore the need to bolster public health capabilities here in the United States and in other countries. It should also point us toward the need for greater international cooperation in preventing future outbreaks and detecting and mitigating those that we can't prevent. Today's seminar will begin with a short presentation by our guest, Dr. Yong-Kyun Kim, followed by a discussion between him and me. Then we will dedicate the last 15 or 20 minutes of our hour together to your questions. We encourage you to submit questions at any time throughout the presentation using the Q&A box at the bottom of the screen. We'll cover as many of these as time allows. Finally, please note that this event is being recorded. We'll be posting it on the Ash Center website, on the Ash Center's YouTube channel, and also a link will be placed on the Program on Crisis Leadership website. So you may review this session or recommend it to your colleagues and friends. Now let's begin our program. It is definitely a pleasure to welcome back to Harvard Kennedy School our speaker today, Dr. Yong-Kyun Kim. Dr. Kim is an alumnus of the Kennedy School's Mid-Career Master of Public Administration program. He received his bachelor's degree from Seoul National University and later his PhD in Science and Technology Policy from Yonsei University. Dr. Kim has had a varied career, including service with the United Nations in Africa. He returned to Korea several years ago to help revamp its emergency management systems and practices. Currently, he serves as Director General of the National Disaster and Safety Control Center, which is part of the Ministry of Interior and Safety. In that position, he's been working to improve Korea's national disaster and safety management systems, develop resilience policies against catastrophic events, and of course, he's been deeply involved in the COVID-19 response. In addition, he's also been supporting international cooperation to cope with transboundary risks, such as extremely fine particulate pollution and infectious disease. And he's been working with other nations in line with the Sustainable Development Principles of the United Nations. Dr. Kim is also a scholar as well as a public official. He's the author or co-author of several books, including Disaster Risk Management in the Republic of Korea, and a new volume called Disaster Management, which came out this year. Please join me in welcoming Dr. Yong-Kyun Kim. Dr. Kim, the floor is open for you.
Okay, thank you, Arnold. I will share the slide. And it is a great pleasure for me to join this webinar to share Korea's successful experience in responding to COVID-19. Today, I would like to share the 4 success factors of Korea, that is crisis leadership, innovative technologies, risk governance, and global solidarity. Korea had to deal with the unexpected situations like a surge of the confirmed cases in February 2020. After the 31st case was confirmed on February 19 in Daegu City, the number of new corona cases rapidly increased, peaking at 909 on February 29. In the slide, it says the phase 2. But Korea drastically reduced the confirmed cases and flattened the curve within a month and has been taking various proactive measures to keep a stabilizing trend and return the society on a path to normalcy. First, the leadership of the President, Prime Minister, and head of the Korea Center for Disease Control and Prevention, Korea CDC, have played a critical roles in fighting COVID-19 in Korea. They show that identifying emerging issues, making evidence-based decisions, unifying administrative efforts through the democratic process are essential features for crisis leadership. President Moon Jae-in quickly and sharply understood the crisis situation and made proper decisions based on expert groups' advice. He put the national priority on mobilizing all available resources to prevent the nationwide spread of COVID-19. When confirmed patient rapidly increased in Daegu City in February, Prime Minister Jung Se-kyun stayed in the region for 3 weeks and solved various problems in the field. Those are the pictures by the Prime Minister Jung Se-kyun. He also chaired daily video conferences with the participation of relevant ministers, city mayors, and provincial governors. The conferences consist of situational reports, various feedback sessions from participants, and debates about the expected problems and solutions. This democratic process helped to reduce the gaps between measures prepared by the central government and implementation in the field. Both the President and the Prime Minister gave complete authority to combat the spread of COVID-19 to Dr. Jung Eun-kyung, head of the Korea CDC. With this empowerment, Dr. Jung was able to control all emergent situations effectively. And during daily briefings, she explained the current situation and government measures candidly and sincerely. Thanks to her efforts, citizens' trust in the government response was built, which was a great part of Korea's success to fight COVID-19. Korea's successful response was also centered on widespread testing, contact tracing, and rigorous treatment labeled the 3T strategy. This was made possible through technology innovation and the extensive use of ICT tools along with an enhanced security protocol for data protection. The typical examples are RT-PCR diagnostic test kit, along with a rapid approval system, innovative drive-through methods and work-through booths, smart quarantine information system, and mobile application and GIS-based situation board. The new diagnostic kit using real-time reverse transcription polymerase chain reaction, RT-PCR, made it possible for medical staff to get diagnostic results within 6 hours. This kit was able to be used thanks to rapid approval by Korea CDC and Ministry of Food and Drug Safety. The rapid approval system, also known as emergency authorization used by the Korean authorities, shortened the required approval time from 1 year to one month during an emergency situation. Another example is innovative drive-through testing method and walk-through booths. The drive-through screening method made it possible for suspected cases to take the test within 10 minutes in their vehicle, reducing the risk of cross-infection. While the general screening center took 2 samples per hour, the drive-through method was able to survey 6 people per hour, 3 times. For the walk-through booth, a potential patient enters a booth, and then a medical staff securely outside the booth take on-the-spot samples from patient. This method takes only 6 to 7 minutes per person. Thanks to these 2 methods, potentially infected people were able to conduct their whole testing process safely within a vehicle or inside a booth. The next one is the ICT-based quarantine information system. This is a typical example of using ICT tools which all rebound travelers should install in their mobile phone. The system easily identified persons coming from high-risk regions and monitored them during the incubation period of the infection. The last ICT used tools is the self-quarantine safety protection app and GIS-based situation board. The self-quarantine safety protection app was developed by the Ministry of Interior and Safety. This app was very useful to check on people who had entered the country and were in self-quarantine. With this app, the tracking of the phone's GPS location of the self-quarantined person could be done with their consent. If the self-quarantined person leaves their designated residence without approval, a warning message would be sent to a dedicated official, and their location would be displayed in the GIS-based situation board. Next, I would like to highlight the risk governance for Korea's successful response to COVID-19. Clearly defined roles and responsibilities among responsible agencies were described in the Infectious Disease Response Manual. Korea has enhanced the Infectious Disease Response Manual through the learning process in the previous response to SARS in 2003, H1N1 in 2009, and MERS in 2015. For example, the role of the direct response agency like the Korea CDC and a coordinating agency like the Ministry of Interior and Safety, like the United States Department of Homeland Security or FEMA, were clearly divided in the response manual. The Ministry of Interior and Safety took charge of monitoring and managing self-quarantined people, operating temporary living facilities for inbound travelers, and coordinating all other central ministry support and local government countermeasures. Thanks to this support, the Korea CDC was able to serve as the command center to prevent and control infection. Another important aspect of risk governance of Korea is that the Korean government kept the entire response process transparent to the public. This slide shows the mobile text message about the status and movement path of the confirmed cases distributed by the local government. The government transparent disclosure of information during the entire response period has played a critical role in building social trust, which facilitated voluntary engagement and participation by all citizens. Most of the citizens practice preventive measures, such as observing personal hygiene, proactive diagnosis, thorough self-quarantine, and social distancing. Finally, I would like to highlight the global solidarity. The strong international cooperation is a very important success factor. In the extraordinary virtual G20 summit held on March 27 this year, President Moon emphasized that stronger global solidarity is essential in overcoming this novel global crisis. In adherence to WHO recommendations, the Korean government is effectively managing the risk associated with cross-border traffic, not with blanket entry bans, but with continuous adaptation and fine-tuning of the measures designed to control and keep track of inbound travelers. Thank you for listening. If you have any further questions, please feel free to contact me via email after this webinar. 감사합니다.
Thank you very much, Dr. Kim, for that very interesting and informative presentation. Let me start us off by asking a few questions to follow up on some of the points that you made. You mentioned that the Korean government had learned and the Korean people had learned something from the experiences of SARS and then H1N1 in 2009 and the MERS outbreak that you had in either 2014 or 2015. I wonder whether you could tell us a little bit more about what lessons you carried away from that.
Okay, the Korea learned a lot of things from the previous the infectious disease. The first thing the Korea had learned from the MERS is that during the MERS, actually the government received a lot of criticism about the insufficient initial response, such as the lack of infection control professionals and delayed information disclosure during the MERS outbreak in 2009. After that, the Korean government laid out a plan to reform the National Public Health Emergency Response System on September 1, 2015. It was aimed at preventing import of infectious disease, ending them at the earliest possible stage, and minimizing the related damage. Also, the enhanced response manual based on the lessons learned from the response to SARS in 2003, H1N1 in 2009, and MERS in 2015 played an important role in ensuring the Korean government proactive and rapid response against COVID-19. During the MERS, there was a confusion among the responsible agencies, the roles and responsibilities. Therefore, the Korean government designed a pre-planned response manual. The pre-planned response manual clearly delineated the roles and responsibilities among the responsible agencies, especially the direct response agency like the CDC, Korea CDC, and the coordinating agency. Although the pre-planned response manual may not cover all aspects of the emergent risk, however, the clearly delineated roles and responsibilities among responsible organizations at least can contribute to minimizing the decision error and the overuse of resources during the very early stage.
So thank you. So you went into the crisis of COVID-19 with a strong set of plans that you had put in place that were based on some of the lessons that you'd learned, and also with a determination to take quick action. As the COVID response has developed, I imagine that Korea, just like many other countries, has been learning lessons along the way and has found it appropriate to make some changes in the way that it's responding, either in terms of things that we've discovered about COVID scientifically as we've gone along, or in terms of plans that you had that didn't work out as well as you would have liked. I wonder whether you could talk about that in terms of how policy has evolved in Korea and what lessons you've learned over the last 8 or 9 months as the crisis has developed.
Yeah, actually, the pre-planned designed manual cannot cover all the aspects of the COVID-19, especially these types of emergent risk triggered by the COVID-19. So Korean government has several problems, and we adapted the various policies according to the situation. The first mistake actually the Korean government faced is the imbalance between the supply and the demand of the face mask. When the outbreak in Daegu occurred, the many Korean people concerned about the face mask. So, and unfortunately, the face mask, the government cannot cover the whole supply of the face mask. So therefore, we transparently disclose the situation to the citizens, and we covered it. As the public concern about the COVID-19 increased, the demand for face masks across the country, irrespective of various measures taken by the Korean government, such as banning profiteering, the price of masks to continue to rise unabated and shortage occurred. And even citizens criticized the government for not having provided enough face masks. And the government designated pharmacies and post office as public dealers to sell half of the domestic mask distribution. But still, the supplying of few million masks a day was not able to meet the needs of citizens to buy masks. Finally, the Korean government implemented a 5-day rotation face mask distribution system, which allows citizens to purchase 2 face masks a week on a designated day. And local government notifies citizens of the mask sales time through the mobile CBS text messaging and promoted citizens to be considerate of the people who were in a desperate need. And thanks to these efforts, the problem was solved. Those are attributed to the administrative effort and tailored to the situation and scientific report and citizens' cooperation. Thanks.
So those measures that you've taken and some of the adjustments that you've made have no doubt been helped by the fact that Korea has a universal health insurance program that covers all citizens of Korea. Perhaps you could point out to us in the United States who don't have such a universal health plan, how that has helped Korea, where it has been effective in covering the costs for ordinary people, and also perhaps if there have been any problems with the way the health insurance program has worked in the COVID crisis.
Yeah, the Korea's successful response to the COVID-19 pandemic made the most of our advanced the medical system. Actually, it has been developed continuously based on the lessons learned from the MERS and the H1N1. In 2017, the Korea's hospital beds reached 12.3 per 1,000 person, and the second highest in the world, and 2.6 times the OECD average of the 4.7. Also, the National Health Insurance Service has played an important role in strengthening the country's healthcare system. All residents of Korea are obliged to enroll in the National Health Insurance. Also, Korea's digitalized healthcare system also played an important role in the nation's response to the pandemic. Moreover, the Korea's digitalized healthcare system played a significant role in the nation's response to the pandemic. The digitalized system of the National Health Insurance Service has been established over the years, and it enabled the smooth and quick processing of health insurance review, bill claims, and payment related to COVID-19. It also used for the face mask problems. The use of this system for publicly distributed face masks allowed mask sellers to effectively block repeat purchase in a given day, and both sellers and buyers to check the inventory status in real time. It's very hard to compare with the United System healthcare system, but definitely the cases of the healthcare system would be helpful for the countries.
Thank you. Many of the things that you talked about in your presentation depended on some degree of voluntary cooperation from citizens of Korea. And that certainly includes things like the personal hygiene actions like frequent hand washing. It includes social distancing measures like maintaining space among individuals or avoiding large groups of people who are gathered together. Certainly, if people were exposed to COVID-19, you depended on them for self-isolation and quarantine. And mask wearing, of course, which has been a huge issue in the United States, also depends heavily on voluntary cooperation. That seems to have been achieved to a great degree in Korea. And I wonder if you could comment on why you think Korean people have been so willing to cooperate with these voluntary measures, some of which are onerous.
Yeah, I believe the transparency is very important that we should consider. To be honest with the current situation and to open up information transparency was the key to the entire period facilitated by the voluntary engagement and participation by all citizens. Since the early stage of the COVID-19 outbreak, the Korean government, centered around the KCDC, has transparently disclosed their confirmed cases and patient treatment situation and the government countermeasures. Especially the government daily briefings and transparent disclosure of the COVID-19 situation help the citizens trust and follow the government countermeasures. Especially Dr. Jung Eun-kyung, head of the KCD, she showed consistent and candid comment, information-based analysis, and patience through the daily briefings. Those helped the public to trust and follow the government countermeasures in a heightened crisis of COVID-19. On top of that, local government and KCD promptly conducted the epidemiological investigation of suspected cases to determine whether or not they were confirmed and examined the root of the confirmed cases. Those information was promptly distributed to local residents to the extent that their personal information was not exposed. Among citizens that received the information, those who might contacted the confirmed patient reported to the public health center voluntarily and requested an examination. I believe those are the key of the voluntary citizens engagement.
And so you feel, I take it then, that these measures and those actions were, at least to a substantial degree, responsible for the trust that people have had in the government.
Correct.
Okay. There have been one or two examples of very obvious non-compliance with some of these measures. Perhaps the most notable was the super spreader event that happened at the church in Daegu, where I gather that many hundreds of people came together, and that was responsible for the first big outbreak of COVID. I wonder whether you could tell us a little bit about both why that occurred, and secondly, what was done to follow up afterwards.
Yeah, correct. Actually, the Korea faced a very difficult situation due to the religious groups, the gathering. Actually, even though the Korean government brought several times about the issues of the gathering, but it happened, and but the Korean government did not sort out issues by providing penalty to them. Actually, the Korean government in the Daegu, there are a lot of there's a skyrocket confirmed cases in Daegu. The Korean government tried three things. Without blocking the Daegu and Gyeongbu regions and open the provide penalty to the religious groups, the government chose three proactive countermeasures. One, conducting mass diagnosis and disclose information transparently. Second, maintaining democracy in civil society and enhancing mutual aid based on community consciousness, and introducing innovative technologies. First, the Korean government investigated thoroughly the members of the Sincheonji cluster and conducted on average 10,000 RT-PCR tests per day and quickly identify the infected people. In addition, it raised the national crisis level to red on February 23 and established the emergency countermeasure headquarters led by the Prime Minister. Also, the extensive use of innovative methods for testing, tracing, and treatment contribute to gradual downward trend of the new confirmed cases. Lastly, citizens and other regional governments helped the Daegu and Gyeongbuk overcome the crisis emergencies. Doctors and nurses from across the country volunteered to the region and treated the surge of COVID-19 patients for more than a month. However, there is another aspect of the government reinforcement about these issues. The Korean government focused on promoting COVID-19 precautions to the public through the TV broadcasting, various media, and many local governments distributed guidebook of the diagnosing. However, the problem issued and especially the face mask and the gathering in the religious groups. First, the face mask wearing, the initial focus was on voluntary participation of citizens, but when the situation became serious, the government chose to impose a fine to the person not wearing a mask at public place, and from the November 13. And also from the April 5, anyone who violates the quarantine requirement would be imposed on imprisonment for not more than 1 year or fine of the not more than 10 million Korean won, according to the revised Infectious Disease Control and Prevention Act. And in addition, those foreigners would be deported or banned from the re-entry in accordance with the act.
I want to go back to...
Hello?
I'd like to go back to one of the things that you spoke about in your talk, which is the mobile application for self-diagnosis that you mentioned. And as I understand it, this was a very ambitious effort that involved both getting the consent of the person who is to be diagnosed to enable tracking them. You were able to use information that came from their credit card transactions. You could use that you could use information from their telephone about where they had been, and you were able to then look for closed circuit television footage that might reveal people that they came in contact with in the areas that they were in. And I wonder whether you could tell us more about how well that worked, what kind of cooperation you've got. Was there much resistance from people? And particularly, I think it's something that at least American citizens would be very concerned about, was the balancing that was required in an app like this between public health, data security, and the privacy of the people who are involved.
Okay, let me clarify because the connection was not good. The first question was about the mobile application, and second one,
it worked.
Yeah, second one is the balance between the data security and the public health, correct?
And privacy.
Okay, great. Yeah, first the self-diagnosed application. The Korea CDC developed the self-diagnosed app that allows the travelers to self-diagnose COVID-19 related fever and health conditions and report them to the local health center or KCDC. The self-check mobile app comprises three things. One, a screen where the user under the special entry procedure is requested to enter the information, such as the passport information, nationality, and contact information. Second, the screen where the user conducts self-check of the symptoms, such as fever, cough, or sore throat, and submit the result once a day. And third, on the screen directing the user to the KCD 1339 call center or social media counseling channel and offering information on nearby screening stations. So all inbound travelers should install this app and check their condition for possible symptoms and submit their self-check once a day. And in addition, the sorry, excuse me. In addition, the list of all inbound travelers is provided to each local government, enabling the local authority to strengthen the monitoring system. Another one is the self-quarantine people. As I mentioned earlier, this self-quarantine person's safety protection app allows local government officials to check the self-quarantine person's the locations. And your next question is about the balance between the data security and the privacy or the public health. This is very, very critical issue. Actually, in Korea is also the big issues, and it is very important to keep the balance data security and public health concerns. In Korea, under the Infectious Disease Control and Prevention Act, the public health authorities can have the significant power to collect personal health data across the country during an epidemic. However, while the law enables substantial disease surveillance with the privacy guarantees, it also requires government officials to share with the public basic information concerning its contact tracing efforts. In this way, the law appears to satisfy the government health policy requirement and the public's right to information. It is imperative that even where government permit the collection of data, such collection should be accompanied by a strict personal data protection guarantee and be time limited while also promoting. When concerns on the privacy were raised with regard to the contact tracing and information disclosure, the Korea CDC drafted the relevant guidelines on the time frame, maximum only the 14 days, and scope of publicly accessible information by anonymizing personal information. These efforts are also acknowledged by the UN Human Rights Commissioner. Thanks.
Thanks very much. I wanted to ask another question that stems from your presentation. Korea experienced a sharp spike in the early going in the epidemic, and that it was able to quell and go down to very low levels of infection. And then there was a smaller spike in August, and you've had in recent weeks a rising number of cases. In other places where this has been happening, one hypothesis about what's going on is that citizens are suffering from COVID fatigue. They are simply tired of the restrictions that are going on, and that they've loosened up the protections that they had been taking previously that kept cases low, especially in Korea and some other countries. I wonder if you could comment on that issue of COVID fatigue and describe for us any steps that the Korean government is taking to figure out how to overcome that problem while we're waiting for vaccines to become available.
Yeah, correct. Like many countries, Korea is also facing the second and third wave, but this is a very important issue. After the Korea overcame the first wave centered on Daegu and Gyeongbu region, the Korea faced the second wave in August and are facing the third wave. Actually, the second and the third wave are closely related with the balance between the response to COVID-19, public health issue, and solving the economic problems. The economic issues also related with the fatigues by the citizens. The Korea witnessed a community infection which originated from several hotspots in the Seoul metropolitan area, spreading to the other regions of the country through the churches, call centers, hospitals, and convalescent facilities, schools, etc. The daily number of newly confirmed cases at August averaged at 214 as of the September 22nd, and peaked at 441 is August 27th. the Korean government took the situation seriously and implemented preemptive and strict measures to control the spread of the disease. Specifically, the Korean government responded to the spread by adjusting the level of social distancing measures. As you know, social distancing is very powerful for preventing the spread, but it embedded a lot of burden to the economic situations. So the Korean government were very careful to choose the social distancing level. Actually, during the second wave, the Korean government raised the social distancing level 2 on August 23 throughout the country, and followed by the enhanced social distancing measure for the Seoul metropolitan area, and which was hit hardest from the August 13 to the September 13. Thanks to active the public adherence to this measure, and the government managed to flatten the soaring curve. The number of daily new cases fell to two-digit figures as of September 20, and the numbers of daily new cases. So we told the government adjust very flexibly, depending on the situation, the social distancing level, and cities the cooperate with the government, the measures. And facing the third wave right now, the Korean government is focusing on civic engagement and partnership with the private sectors. The government is collecting ideas and opinions of experts from the private sector and widely reflecting them in setting its policy direction of Korea's response. And the public-private partnership is in line with the direction that the Korean government has taken throughout its fight against the 19. So currently, we are cooperating. Now is just the government issue, it's all the citizens issue, because this COVID-19 cannot be terminated in no time. So the government should go with the citizens to combat with this COVID-19 better. Thanks.
Thank you very much. We've now reached the point where I hope that we'll have some good questions from the audience. And I'm going to turn this part of the discussion over to my colleague, Jajit Ajimal. Jajit is a recent graduate of the Kennedy School's Mid-Career Master's Program. He's a very experienced civil servant in the Canadian government and is coming to us today from Toronto. Jajit, would you like to present some of the questions that have come in from our audience?
Absolutely. Thank you, Arn. Dr. Kim, it was a pleasure to hear your talk. A series of questions have come in from our attendees. So the first one that comes in from an anonymous individual here is, can you tell us a bit more about the relationship between the government's response compared to that of the private sector? Can you tell us more about the role the private sector played in the overall response?
Correct. The Korea's success factor was centered on the cooperation with the citizen and especially the private sectors, because the social distancing level is critically embedded under because closing the restaurant, closing the sports complexes, and even sometimes they should not open during the weekdays. So the private sectors cooperated with the government countermeasures about these issues, and also the government provided the subsidy to the private sectors whenever they cooperated with the government countermeasures. So, and all the citizens they voluntarily participated in reporting their conditions, and also they voluntarily wear the mask during the meetings and even coffee shops. So those public-private the partnership are very critical issues, and even the government to recommend all the citizens wear the mask in their daily lives. So we believe that wearing the face masks are very important success factors of Korea's response to COVID-19.
Thank you. Another participant asks, are there partisan effects to the overall response to COVID-19 similar to that of other countries, such as the United States and Canada as well?
Sorry, say it again.
Are there partisan effects that are impacting the overall response in Korea?
Not so sure, because very sensitive and delicate issues, but I don't think the Korea has serious issues about that. So let me scrutinize it later.
Excellent. Can you tell us a bit more about the response and role of local government leadership, such as governors in Korea?
Yeah, that is very important aspect. Actually, the Prime Minister chaired the daily video conference with the participation of the related ministers and all the regional governors and city mayors. So, and during the daily conference, they discussed a lot of issues. And generally, the countermeasures prepared by the central government should be implemented in the regional and local government, and there is a serious gaps generally because these types of the emergent risk require does not give enough time to review the policies. So during the daily conversations, all the regional governors, city mayors raised the various issues about the policies, and they sorted out in the situation. And also, all the local all the regional governors and city mayors, they recommend all the citizens to report to their conditions to the local health centers, and then they also check all the restaurant situation conditions and the support complexities. So the local governors and the city mayors disseminate the related the government officials to the related sites, and they checked all the situations. And another aspect is self-quarantined people. The management of the self-quarantined people in Korea was very powerful. So all the local government designated an official for the self-quarantined people so that they cannot spread the COVID-19. And then these designated local government officials, they check the self-quarantined people, check the conditions daily basis, and then it helped a lot to not to spread the COVID-19.
Thank you. So when will South Korea open its borders for general tourism?
Actually, we did not block any tourism.
Okay.
Because in accordance with the WHO recommendation, actually the Korea opened we did not block any foreigners, but we provide the special entry procedures. So 14-day the voluntary self-quarantine, and as I already mentioned, the self-diagnosis mobile application. So we kept openness during our early stage. So it's also another important aspect of the global solidarity.
Okay, excellent, thank you. How did you ensure that communication was very effectively delivered to your citizens?
Right, I believe the three things are important in the risk of communication. Definitely the transparency is very important. The first one, every day, the Prime Minister regularly briefed the result of the Central Disease and Safety Countermeasure Headquarters meetings result. And also Dr. Jung explained the situation to the citizens during daily briefing. And that gave a lot of trust to the citizens, and especially the voluntary engagement. Also, the second one is the information about the government countermeasure, and also the status of the impacted people's location and their movement path. The local government and KCD disseminated the information. Actually, they tracked the all impacted people's confirmed cases movement path through the CCTV footage and the GPS location, and they disseminated it to the citizens, and citizens can understand what are the status of the impacted person, the confirmed cases, the movement path, and they reported it voluntarily. So those are very powerful for the citizen to trust the government, the policies, and also not to spread the COVID-19.
Excellent. Thank you. What barriers do you see coming forward in the next coming weeks or months for the country?
Yeah, there insufficient information about the COVID-19, even though the vaccine is developing. We do not have much information about the COVID-19, and it still is a very big issue in the. However, now the Korean government is trying to go with the citizen for the long term battle with the COVID-19. And also the President Moon mentioned about the new Korean New Deal for the COVID-19, because this COVID-19, we cannot stop this COVID-19 right now, but therefore we will utilize these difficulties as an opportunity for our economic and the social issues, to sorting out the economic social issues.
Okay, so a participant is asking a very interesting question of how the country is contributing to the international community's response to COVID-19.
Yeah, the international solidarity is very, very important issue, because I believe many countries have a different aspect about the COVID-19. But however, as I already mentioned, Korea kept open to the international society, and in the extraordinary virtual G20 meeting, the President Moon emphasized that the stronger global solidarity is very important, and the international cooperation is a key for the next generation. So definitely, Korea wanted to cooperate with the international society and make a stronger global solidarity for our next generation. So we are very open to the international cooperation, and also we are sharing our experiences with other countries, and we are sending a lot of the supplies for the developing countries. So those are the the policies of the Korean government to cooperate with the international society.
Okay, I'll ask my final question here from a participant as well. Did you prevent travel within Korea to keep the infection localized?
Sorry? Did
you prevent travel in the country to keep the overall infection localized?
No, not actually. As I already mentioned, when we experienced the skyrocket in Daegu NCT, the Korean government did not lock down the cities. Rather than we rigorously tracked the impacted person, and actually we asked all other regions to cooperate to support the impacted areas. And this voluntary engagement from other regions are very helpful. Now, actually, when there is a lot of the Daegu and Gyeongbu region experienced the insufficient bed and doctors, actually other regions supported the Daegu and the Gyeongbu regions. Now, yes, Busan and other regions are facing the insufficient bed. Now the Daegu city and Gyeongbu are supporting them. So those are very key issues to the social trust and the mutual cooperation.
Thank you very much. I'll turn it back over to Arn, keeping an eye on the time. I'll turn it over to you, Arn. Thank you.
Thank you, Joshi.
Thanks so much.
Let me ask one final question, Dr. Kim. I know that one of the functions of the Ministry of Interior and Safety is to think about the future as well as deal with issues that come up in the present. And I wonder what kind of lessons the Korean government is learning from COVID that you think will be important in preparing for what almost certainly is an inevitable emergent infectious disease crisis that might emerge in the future. We don't know when that might happen. We don't know where it will originate, but we do know that this is something that humanity faces periodically, and that we need to do a better job of getting ready for those things. So how is Korea thinking about that?
Yeah, actually, we are also learning a lot of things from this COVID-19, and I believe the lessons learned at Korea is that this is a typical example of the emergent risk. Actually, through the response manual, actually we cannot, even the response, we can start in the very early stage very fast, but we cannot cover all these emerging issues, especially this insufficient information and also speeding up unexpected risk. So I believe the key lessons from Korea, the first one is transparency. Transparency was very critical to respond to emergent risk with high uncertainty, in that the government direct and transparent disclosure of information during the entire period facilitated voluntary engagement participated by all citizens. So transparency is very, very important, especially in these types of emergent risk with the high uncertainty. The second lesson is extensive use of ICT tools. The ICT tools played a major role in flattening the curve at the most dangerous stage of the phase 2, and now we are also utilizing the ICT tools for the various areas. So the extensive use of ICT tools can play an important role in responding to these types of new emergent risk. And lastly is the double loop learning process. As I already mentioned, the Korea's advanced quarantine system and response manual, actually it has been developed based on the lessons learned from the MERS 2015. Therefore, whenever we learn from this COVID-19, we should enhance our response manual and quarantine systems based on the lessons learned from the COVID-19. So definitely transparency and use of the ICT tools and also double loop learning from this COVID-19 are very important issues. Thanks.
Thank you very much. It's now time for us to close, but before doing that, I'd like to say a few thank yous. First of all, we owe a tremendous debt of gratitude to Dr. Yong-Kyun Kim, who not only has given us great insight into Korea's strategies during the COVID-19 crisis, but did it after getting up at for 5:30 in the morning in Sejong, Korea, where he's based. So we very much appreciate your participation in this session and also your fortitude in being able to be coherent at that early a day and time in the morning. I also want to thank the audience that has joined us today for your engagement and attention, and for the very thoughtful questions that you submitted. That was, I think, crucial to our being able to offer a very valuable session. This event wouldn't have happened, though, without the very productive efforts of a number of people here at the Ash Center and the Program on Crisis Leadership. In particular, Jajit Dajimal, whom you heard from a few minutes ago, who has been the driving force in organizing this series of seminars that we're embarking on today, and also the Program on Crisis Leadership's Associate Director, David Giles. And we've leaned very, very heavily on, as always, on the extremely competent staff at the Ash Center, particularly the event staff headed by Melissa Dinello, and aided very, very capably by Julian Crescimano, and also the communication staff, Sarah Grushka and Dan Harsha. So we will sign off now. Thank you very much for joining us today, and we very much appreciate your participating in this seminar. Take care, stay safe.